The Health in Mind service offers psychological support for patients, families, and staff at Birmingham Children's Hospital. Within Health in Mind, we also have Thrive, our dedicated staff support service. We are a team of psychologists and other clinicians who support young people and their families who are experiencing emotional distress related to their health condition or hospital stay. We accept referrals for children and young people with a physical health condition who are under the care of Birmingham Children's Hospital, but some departments and specialties may also have their own psychologist who links in with their medical team. Some common difficulties that might come up for young people and families who we work with might include adjusting to a health condition, health-related trauma or coping with the traumatic events, dealing with big or difficult emotions, anxiety around procedures like blood tests or injections, or looking after your own mental health whilst caring for a child who is unwell. As well as offering one-to-one therapy, Health in Mind also offers a range of groups and workshops for both parents and young people. We also have our own dedicated family therapy service, and we can also work indirectly through medical teams and other professionals where we are able to share a psychological perspective and help manage complexity. Although we do try to support all young people and families who come through the hospital, it's important to remember that we might not always be the best service for that young person, and we may need to signpost them on to a more appropriate service. For example, we don't usually work with young people with medically unexplained or functional symptoms, and in these cases, we would usually refer to our colleagues in Forward Thinking Birmingham who can provide more specialist mental health support for that young person. We would also not usually see a young person where their mental health difficulties are not directly related to that person's health condition. This might include things like having low mood related to a parental separation or a recent bereavement. At this time, we would also not accept referrals for things like headaches or migraines or constipation.
Thrive Staff Support is BWC's psychological support service available to all staff currently working across BWC. All of our clinical psychologists are in-house and have been working at BWC for many years, so they are aware of many of the different difficulties that staff working here face. Thrive offers support to individuals and teams who are experiencing work-related distress affecting their well-being and functioning. Our areas of focus include workplace trauma, burnout, stress, anxiety and more. Thrive is not a crisis service and does not provide long-term support, so we would signpost you to more appropriate services. Although our remit is specifically around work-related issues, staff are welcome to put a referral in if they are unsure where to go, and we will be happy to offer advice. Thrive offers team support and sessions such as psychological debriefs to process difficult emotions following critical incidents, reflective practice sessions to allow groups a safe space to think about challenging work situations, pro-social workshops to improve team connection and adaptability to workplace challenges, and teaching sessions on a range of different topics such as stress, burnout, anxiety, managing trauma, having difficult conversations, and many more. Thrive aims to provide timely well-being advice and guidance to individuals. They can also offer staff a one-off consultation with one of our psychologists to offer suggestions, coping strategies and signposting to appropriate community services. While our remit looks at work-related issues, we understand that there are many services out there which can be overwhelming for staff, and we aim to support individuals to find the right services to support them. Here are some of the services that are available to BWC staff that we often signpost them to. This includes the B-Source Staff Mental Health Hub, which offers rapid and easy access to specialist psychological support, and the Trust Employee Assistance Programme Health Assured, which offers 24/7 counselling and advice for a range of issues such as mental health, physical health, legal advice and financial advice, among many other things. We are not a crisis service, and if you have concerns about your own safety or the safety of a colleague, then we would refer you to urgent mental health services. If you require immediate support, you can call 999 and request ambulance or police, or you can go to your local A&E department. If you're struggling with mental health difficulties unrelated to work or require community or long-term support, then we would aim to signpost you to the most appropriate services in a timely manner. If you'd like to put in a referral to access support for yourself or your team, simply search Thrive on Google. If you scroll down on our main page, you will find our Request Support from Thrive form, which will ask you for your contact details and reason for requesting support. If you are making a referral on behalf of someone, please ensure that this is only completed with their full consent. Our other pages on Google include our resources page, which has many different resources including coping strategies for managing stress, anxiety, sleep, and more. We also have our urgent help page, which details many of the services that may be helpful to contact if someone is in crisis and needs urgent support.